As a professional in training, we need to thoroughly understand what it means to give diagnosis to our future clients and the consequences they may have. So today, we will clearly explain why there was a need to classify psychological distresses related to the medical psychiatric diagnosis. To begin with, the question of why the classification of nosological system, such as mental disorders in the psychology field, seems problematic and why it is difficult to conceptualize psychological distresses as symptoms of a disease. Do you think we need to diagnose psychological stresses in the same way we diagnose psychological disorders? Yes, Miss Bautista.
I'm in favor of diagnosing psychological distresses the same way we diagnose psychological disorders, since psychological distresses are the root of psychological disorders. And if it is not prevented, it can cause more drastic consequences that primarily affect the functioning of a person.
Miss Rosette?
I disagree with what you have said, Ms. Bautista. Psychological distresses should not be diagnosed and classified as psychological distresses, since the distresses are just one of the four factors of fortis, deviance, distress, dysfunction, and danger in which psychologists often classify behaviors as abnormal by using it.
Okay, let us elaborate and put the argument in context. Distress is when the behavior causes anxiety, bad feelings, or other negative feelings for either the person or others who come in contact with them. It can also be a result of any stress that exceeds a person's ability to manage it. Let's say, for example, Andy is feeling down and does not feel like she can ever get out of bed. She hasn't bathed in 4 days and won't respond to texts from her friends. Given the situation, do you think we should diagnose the case of Andy, who is suffering from distress, the same way we diagnose psychological disorders in DSM-5? Miss Rosette.
My answer is still no. The clinician diagnosed psychological disorder by utilizing the Diagnostic and Statistical Manual of Mental Disorders published by the American Psychiatric Association to determine whether a set of symptoms or behaviors meets the criteria for diagnosis as a mental disorder, meaning there are criteria that should be met for you to diagnose something unusual. Moreover, psychological distress is when you have been facing stress in your life for a while, you may feel overwhelmed. It describes the unpleasant feelings or emotions that you may have when you feel again overwhelmed. People can experience distress at any time and is usually temporary, unlike psychological disorders that persist for long or appear in cycles.
Miss Bautista.
Um, Based from the situation of Andy, who's suffering from psychological distresses, her case and other similar cases should be diagnosed since it is something unusual from normal. She faced stressors that she was unable to cope with. Her stressors come out as sadness, anxiety, and avoidance of social situations. To further elaborate, we usually experience relief from distress when the stressful event or situation ends. However, the mind and body can become accustomed to a state of distress. As a result, our brains and behavior patterns are conditioned to go into state more easily. So there should be a diagnosis to create a better treatment plan and find solutions about it.
I would like to commend the both of you for doing a job well done to conclude the both of your stands. For the last time, I will give you a chance to ratify and further elaborate your stands. Who would like to go first? Miss Rosette.
According to Vita 2007, distress is an underlying component of anxiety and depression that is not transient and not normal, an interpretation that is more consonant with the usage of distress in the DSM and ICD system. In DSM, distress is an essential indicator of the severity of depressive disorders. Still, in ICD, distress is not considered in diagnosing depressive disorders other than as one of the non-diagnostic symptoms for other depressive episodes, meaning distress is conceptualized as a symptom of a disease or a psychological disorder. Overall, we shouldn't diagnose psychological distress similar to psychiatric diagnosis.
Miss Bautista, for the last time.
We have to keep in mind that distress is unavoidable and problematic if we will still conceptualize the psychological distress as symptoms of a disease. Yes, there is a wide range of usual reactions of our body to stressors, and these should not be considered as symptoms indicative of mental illness or mental disorder. We still need to diagnose psychological distresses the same way we diagnose psychiatric diagnosis for us to prevent it to lead to serious psychological disorders.
Now that we've heard both sides, we should consider and understand other factors like there is psychology per culture. Each society establishes norms, stated and unstated rules for proper conduct, in which each culture identifies and deals with deviant behavior in its way. In addition, there are different methods of understanding people's emotions and other psychological related issues that are rooted in their experiences, ideas, and cultural orientation. Interestingly, many mental health professionals agree that psychological disorders are characterized by personal distress and impairment in multiple areas of life. So, what was really the purpose or the point of getting a diagnosis? We need to apprehend that diagnosis is an essential component of creating an effective treatment plan. It is more than just putting a label on an issue. It's also about finding solutions, treatments, and information about it. Further than that, psychological distresses are one of the factors for unusual behavior to be diagnosed as a psychological disorder. We also have to keep in mind that abnormal behavior, thoughts, and emotions again differ markedly from a society's ideas about proper functioning. Remember that we are all abnormal relatively, and all of us are predisposed to abnormality.